I literally told her that. I was like, you should hire me. And she was like, let's have an interview right now. So we had an interview and I got the offer letter and all of that. And she's like, I've been looking for an acupuncturist. She's like, I can't tell you how much of a relief it is just to have one walk into my clinic and tell me I'm your acupuncturist. You're like, you just appeared out of nowhere and I've been needing you. And she's really excited to have me start. I am so excited to start with her. She's just an amazing woman, an entrepreneur. She's built this amazing sports rehab clinic. So yeah, that's kind of where I stand on the acupuncturists trying to find work.
I'm Michael Max, and this is Geological, the podcast that curates East Asian medicine and methods through the power of conversation. I recently had someone at a party ask me an unexpected question when they heard that I practiced acupuncture. It wasn't the usual one about, does it actually work? No, this person asked me if I liked practicing acupuncture. The answer seemed patently obvious to me. So I've sat with this question of, do I enjoy practicing acupuncture? And the answer is still a resounding yes. But it brings me back to this inquiry of why it's so. And I think it is because it still makes me pause with appreciation and curiosity when a few well-placed needles can create the response that they do. The practice of acupuncture is nonlinear in an almost subversive way. Different perspectives and methods, seemingly contradictory, can bring results. We like to use the metaphor of there are different ways to get up the mountain. All well and good, but at least in my mind, I easily tip into that there is a right and wrong way of going about things. Consider for just a moment if this is true for you as well. And if so, how genuinely radical is it that my curious wobble in tracking down an effective treatment can rely as much on a hunch as data, that I can open my sensorium in a way that has me finding something not only that I'd not been looking for, but find bothersome in how it now forces me to change my mind about what I think is going on. Medicine, as the conventional world would tell you, is a knowledge and evidence-based system that not only is flowchartable, but should be. So I like the practice because it's surprising. It's hard because while there are landmarks, there are no turn-by-turn GPS directions. It makes me pay attention. It leans on the edge of discovery. It demands I cultivate a friendly relationship with uncertainty, that I find a way to track a patient's problem through the terrain of their body, psyche, story, meaning, manifestations, and desires. Perhaps I enjoy the practice because while there is a part of me that would prefer the world to be settled, stable, and predictable, being on friendly terms with fluidity means it's possible to find something that I had not been looking for, that while it does not solve the problem, it points the way to where I can intervene in a helpful way. Acupuncture often brings up a feeling of déjà vu, a feeling of having been in a place that I've not been to, but there is a familiarity to the experience that puts me on friendly terms with what's novel and new. It's good work for those of us that enjoy and have a heightened need for novelty. When I was in high school, I enjoyed the imaginative world of Carlos Castaneda and his adventures in learning to see the world with the eyes and heart of a sorcerer. Maybe if the web that has no weaver had been available, then I would have cottoned on to Chinese medicine with its ways of seeing how we are intertwined with nature, how the mind of a forester or gardener is not so different from the mind of a healer. But there were young people in a more recent time who did read about Chinese medicine as part of their extracurricular adventures, and some of them listened to Geological. Will Martin was one of those. He wrote me some years ago with a question about Jingwell points. In this conversation, we catch up with Will just as he's graduating from acupuncture school. What does he see on the road ahead? Stay with us. We'll get into it after a few words from the folks who make it possible for you to enjoy Qiological. Qiological Conversations come to you through the generous support of our sponsors and members. You have clinic challenges? Our sponsors have solutions. Mayway focuses this month on stress, anxiety, and sleep issues. Are you licensed in California and want to get the best insurance reimbursements? AcuCare can help. Blue Poppy has a special on their Great Nature Classics line this month. Later in the show, you'll hear about how Jane's suite of clinic management tools makes office work a breeze, and a heartfelt holiday message from everybody at Golden Flower Chinese Herbs. Be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast.
Hi folks, I'm Yvonne Lau, president of Mayway Herbs. December is often a stressful month, so we're focusing on anxiety, sleep issues, and cognitive decline, areas where Chinese medicine can offer powerful but gentle solutions. In our newsletter and on our Chinese Medicine Matters podcast, we'll explore classical formulas and time-tested, clinically useful approaches for calming the spirit, supporting restful sleep, and nourishing mental clarity. Since 1969, Mayway Herbs has been a trusted source for high-quality herbal products. Our Plumflower brand line includes pills, tablets, extract granules, and organic herbs. And with educational resources, articles, and videos, we're here to help you provide the very best patient care. Visit us at mayway.com to learn more. We wish you a peaceful holiday season, and on behalf of everyone here at our family business, I'd like to offer our deep thanks, as always, for your support. Here's to balance, clarity, and well-being with the wisdom of real Chinese medicine.
Are you a California licensed acupuncturist who accepts insurance or wants to? Are you satisfied with your current reimbursements? You could be earning more. With the right support, joining top insurance networks such as Cigna is simple. AcuCare was started 30 years ago by acupuncturists for acupuncturists. AcuCare has already negotiated top reimbursement rates for acupuncturists. With AcuCare, you'll spend more time with patients and less time battling insurance paperwork. Email acucare@acucare.com and let them help you get in-network with Cigna and other well-paying companies. Get paid what you deserve. Email acucare@acucare.com and save $100 on your credentialing application fee. Use the code PROSPER. That discount code again, PROSPER. Contact acucare@acucare.com to get higher reimbursement rates and a credentialing company you can trust. Running a clinic means always having the formulas that you rely on. And this season, Blue Poppy is making it easier than ever to stay stocked. From now through the end of the year, enjoy 15% off the entire Great Nature Classics line. These trusted, time-honored herbal formulas are practitioner essentials, and now's the perfect moment to replenish your shelves before the New Year rush begins. Whether you're refreshing your dispensary or simply planning ahead, this limited-time savings makes it easy to stock up with confidence. And for patients traveling this holiday season, Blue Poppy's free-to-use dropship service makes it simple to get them the formulas that they need right to their door. And just like your clinic orders, dropship orders over $50 also qualify for free shipping under their standard shipping policy. Start the new year prepared. Save 15% on Great Nature Classics at bluepoppy.com. Will Martin, welcome to Qiological.
Hello, Michael Max. How are you?
I am great. This is kind of cool. You know, often I will lead off a podcast asking people about how they got interested in Chinese medicine, because back when we was kids, nobody in high school knew about Chinese medicine. But you have a different story.
I do. I started delving into Chinese medicine at the young age of 15, probably a little too early for my own good, but I am very glad that I did so.
Too early for your own good.
I think I caused myself a lot of stress in high school because I didn't know what a Jingwell point was, and I didn't know what Lian Chao was, and I needed to know all these things, and I needed to know them quickly. And it was just such a fascination And it was, I tried reading all the information that I could on it, and it's like I could never, ever get enough. I also had friends and family tell me that I wouldn't make it in life as an acupuncturist, so that was a thing. But yeah.
Okay, you're 15, you're in high school. Like, why the hell would you even be interested in a Jing-Well point? Why do you have to know about that? What is going on for you?
Well, it was a lot. So essentially in high school, I was in anatomy and physiology class, and I had to write a paper on a pathology of our choosing. We could choose whatever we wanted to. At the time, my mom had really bad frozen shoulder adhesive capsulitis, and I decided to write it on that. So I was researching, I was reading, I was going through all this stuff. And I was like, okay, we got steroid shots, we got narcotics, we got physical therapy, we have all of this. And then at the middle of the page that I was on, this little blurb came up saying acupuncture. And I was like, okay, well, what the heck is acupuncture? Like, I had been able to equate acupuncture with needles. That's all I knew. That was the only thing that I had on acupuncture. So I read and I started reading, and I found that acupuncture was very effective for frozen shoulder. I was reading about local points, distal points, stomach 38, which at the time made absolutely no sense to me, because I was like, well, how can a point on the leg affect the shoulder? And then from there, I went down a very deep, dark hole of Chinese medicine and just kept reading and reading and reading and reading. And I was like, okay, well, this actually is like medicine. This is for everything. And so I got really interested. I started ordering books. I ordered Machiocha's first edition at age 16. I still have it. I bought The Web That Has No Weaver, Between Heaven and Earth, a bunch of other books. And I just kept reading and reading and just developed this fascination with acupuncture. And at the same time, I was like, well, I need to listen to acupuncture stuff while I'm walking or running or whatever. And so then that's how I stumbled upon the Qiological podcast at 15. And I've been listening ever since, and I've been reading ever since, and have been in love with acupuncture and Chinese medicine ever since.
Yeah, you were kind of in love from the get-go. I remember getting an email from you asking about Jing-Well points.
Oh, God.
Do you remember that?
I do remember that. I would love to see what that email said. I was probably a little tragic, but that's okay.
I probably don't have it, but now I wish I had kept it. Because it's kind of cool, like getting an email from a 15-year-old. I want to know about Jing-Well points. I mean, it was a little bit unusual.
Well, I remember you talking about I don't remember if it was a podcast specifically on the Jing-Wells as much as the transport points. I think it was like the transport points as a group. And you were talking about the Jing-Wells, and you were talking about how dynamic and how powerful they are. And it's where Qi kind of like warps and is like very dynamic at these points, and then it flows along the channel. And you're talking about like the uses for them. And I was like, well, that's pretty cool. Who in their right mind would not want their Jing-Well points needled? And so I need to know what that means. And then that's when I sent the email. Please explain.
Now, how old are you now, if I may ask?
24.
24. So this is almost 10 years ago.
Yes.
That you've been interested in this. What kept you going? I mean, like your family was saying, hey, Will, this might not be a great way to make a living. We love you. It would be nice if you could feed yourself.
Yes. So I had originally wanted to go to medical school, and there was a medical school in Maine that I was looking at going to. And at a very young age, I wanted to be a doctor. That's what I wanted to do. I wanted to be a doctor, but I wanted to work in the ER. That's what I always have wanted to do. And so my parents were like,
no wonder you're into Jing-Well points. You like extreme extremities.
I do, yes. And I was like, well, I'm going to go to medical school, blah, blah, blah. I was taking all the prereqs in undergrad or whatever. My undergrad degrees in medical and health science. And at the last minute, there was a lot of life things that happened, which is weird because I feel like anyone who goes into acupuncture usually has some type of pretty like significant life event that either pushes them or pulls them into Chinese medicine. I don't know if that's true, but for me, that was the case. And I decided at the last minute before pursuing the MCAT to go to acupuncture school. And I did have some friends and some family tell me, you're not going to make money. This is a little woo-woo. This is kind of sounding like you're just becoming a Buddhist monk. I actually heard that. And I was just like, I don't believe that. I don't see that. And I just don't believe it. And this is what I need to do with my life.
Damn the torpedoes, full speed ahead.
That is right.
Yeah. It's interesting. I think you are correct. Many of us in the field something happened. We got a story. But I don't think we're the only ones. I was listening to a podcast just the other day. I like listening to people that are talking about business and entrepreneurship because I think all acupuncturists, unless you're working for somebody, you're also an entrepreneur in a sense. And there's a mindset that goes with that. And there was something that someone on the podcast said about all entrepreneurs have a story. It's usually not a pretty one either. It's usually some kind of trouble, right? There's something in the background that was some trouble. And it takes you down a certain path. It'll give you a direction. In the moment that it's occurring, it's not pleasant, but it opens up a whole different world.
It really does. It really does. And going into acupuncture, Chinese medicine, it opened up a whole new outlook on life and interpretation of life for me. It was truly mind-blowing. And when I think about it, if I think about it long enough, I get a little overwhelmed. But it truly like just changed the way I live my life. It changed the way how I interact with people, how I form relationships, how I end relationships. It's very impactful, and it still is. And it's going to be like that until the moment I die, not to be morbid, but it sticks with you for life.
What would you say has changed? How do you notice yourself being different, or maybe there's opportunities that you hadn't seen that you now see, or maybe problems that come into focus? I don't know. How would you describe yourself as being different because of studying Chinese medicine?
I guess the biggest thing that comes to mind immediately is there's always two sides to a story, and there's always two sides to a life. And when we think about that, you can link that right to yin and yang. There's yin within yang, there's yang within yin. It's always transforming into one each other. They're mutually controlling each other. Nothing is absolute yang and nothing is absolute yin. And I think before coming to acupuncture, I had a mind opposite to that. I had a very black and white, there's no gray area, scientific mind. And when I got into acupuncture, I found that none of that was really true, and that there's a huge gray area in a lot of things, not just health, medicine, and science, but also just life, relationships, feelings, emotions, the way that we decide to conduct ourselves. And that mindset really helped me when I saw my first patient in acupuncture school and student clinic. There's always two sides to the story. I would look at a patient and I'd be like, they really strike me as an intense yin type of person, but the yang is here somewhere. And I need to have that information to complete this picture of how I view this person.
Two sides to the story.
Two sides to the story always. And it's something to easily forget. I've definitely forgotten it, but it's really helpful when you can remember it. There's two sides to the story, and not everything is as it appears as it seems.
Yeah, man, if you took nothing more than that, regardless of what else you pursued in your life, it would probably be really helpful.
I think it would serve a lot of people well.
Yeah, I feel the sense about that. What about the concerns that your relatives have? And they're not unfounded concerns because, look, making a living as an acupuncturist, it's not so easy, right? There are some challenges. Of course, any interesting life will have challenges, but for sure, money's an issue. You're a very recent graduate. I suspect you and your cohort of students have been talking about, okay, what's next? Probably with some trepidation and like, oh my God, what are we doing now? Talk to me a little bit about what it's like on the other side of school as you're about to approach your practice. What about that money piece? What do you see for the future for yourself and people like you?
To be honest, I don't really see any issue. I was in a cohort of about 40 students. 13 of us were herbal students, so we are just now getting our diplomas and getting ready for board exams. The acupuncture-only students have already taken their boards, and I don't know of anyone in my cohort that does not have a job already. There's plenty of people...
Wait, hang on. No one in your cohort doesn't have a job?
If they
all have
don't,
jobs?
I do not know about them. And I was a very talkative social butterfly in acupuncture school. So I know a lot about these people and stay in touch with them. And I have not heard of anyone not having a job. I know of, right off the top of my head, people working in Boston, in other parts of Massachusetts. There's a couple of people in Connecticut. There's one person flying to Washington to practice in a clinic there. There's a couple of people that have opened up their own businesses. We have a few massage therapists who are just incorporating it into their massage practice, and they're thriving. They're doing excellent. And I would say that acupuncturists don't come to the field with the idea of, I'm going to make money. I think they come in with just the want to help people. But it's a huge bonus to actually make good money coming out of acupuncture school, especially as a new grad. I mean, I myself have a job lined up at the moment I get my license in 2 clinics in Massachusetts. And it's one of those things that, like, yeah, I cared about it. I was caring. I need to make money. I need to work all through school or whatever. But it kind of just fell into place. And from what I've been hearing, people are begging for acupuncturists to work. So I guess I have no worries or no concerns. Even the people that are entrepreneurs and opening up their own businesses, they're already developing wait lists all throughout New England.
Wow. Okay. This is so different from when I graduated. Because when I graduated, you were for sure working for yourself. I mean, you might rent a space in someone else's clinic, but there weren't many JOBs for acupuncturists. So it was very clear that you're going to have to go it on your own. I know things have changed over the years. I'm a little surprised to hear that there are so many jobs that people have a choice, that there are clinics really looking for acupuncturists. That's such a different landscape. And there's also a not small undercurrent of people. You'll find them on the internet, on Facebook. God forbid you wander into the acupuncture lunchroom, and people are not happy with their situation. So how do you make sense of that there are so many in our field that are disappointed and unhappy and feel like they're not making it and they don't have opportunity, and yourself and your colleagues, where it sounds pretty dang rosy?
I have 2 views on that. One might get me canceled, but we'll see how it flies. The first one is, I think my school did a very good job preparing us to enter the workforce and to get licensed and to start practicing. And the school that I attended, they did a really good job at providing jobs to us. They would send out emails a couple times a month with 5 different jobs all over the country. So they really helped support us as we were exiting acupuncture school and finding work. The other thing is, and this is it could be wrong, but this is just a personal assessment of mine. I think there's a lot of acupuncturists, more so recent graduate acupuncturists or acupuncturists who have only been in practice for maybe like 1 to 3 years. And they struggle with marketing themselves and putting themselves out there. And I just feel like there's the most recent graduating classes of acupuncture from the schools in America or whatever. We are scared to not have a job, and we will put ourselves out there. I mean, I went up to so many people at the ASA conference this year, people I probably should not have been talking to, and just kept my distance and yes, sir, yes, ma'am, respected the space and moved on, and went up and talked to them and formed connections and networked and marketed myself. And the one clinic that I'm working at in Massachusetts, I got actually from a patient in student clinic. She got me into that job. The other place, I just walked in one day for a massage I walked out and I asked the woman at the front desk, I was like, "Are you the manager here?" And she said, "I actually own this place." And I said, "Well, you should hire me. I'm an acupuncturist." And she's like, and she's amazing. I literally told her that. I was like, "You should hire me." And she was like, "Let's have an interview right now." So we had an interview and I got the offer letter and all of that. And she's like, "I've been looking for an acupuncturist." She's like, "I can't tell you how much of a relief it is just to have one walk into my clinic and tell me, 'I'm your acupuncturist.' You just appeared out of nowhere and I've been needing you." And she's really excited to have me start. I am so excited to start with her. She's just an amazing woman, an entrepreneur. She's built this amazing sports rehab clinic. So yeah, that's kind of where I stand on the acupuncturists trying to find work and stuff.
Will Martin, you just struck up a conversation with the person who was checking you out. It turns out it's the owner. "Hi, I'm an acupuncturist. You should hire me."
Yeah,
Okay, not everybody has that kind of chutzpah.
that's true. That is true.
Do you come by it naturally, or is it cultivated?
I come by it naturally. I've always been like that. Sometimes it gets me in trouble, but most of the time it plays into...
I'll bet it does.
It does. It does get me into trouble.
But is it usually good trouble, or is it like really bad trouble?
Usually it's good trouble. Usually gets me into some good trouble and some good conversations that start out with this might go south really quick, but then it usually 9 times out of 10 turns out going really well, actually. And I've formed a lot of connections and I've formed a lot of relationships that way. And I'm not saying everyone should be like that, obviously. That is a characteristic of individuality. But I think acupuncturists might be a little bit more on the timid side, most of them. And I think breaking loose a little bit and speaking your mind and saying what you need and what you want, and there's going to be someone out there who can give it to you, and they're going to want what you can offer. And that's exactly what happened between me and this owner of this sports clinic. I was offering one thing, she was offering the other. We both had no clue either her or me were offering these things, and we kind of just said it out loud in front of everyone, and it worked out.
As the great hockey player Wayne Gretzky used to say, you miss 100% of the shots you don't take.
Absolutely.
How do you deal with the rejection? Because look, when you put yourself out like that, some people are going to pick it up. Oh, this guy's got game. Let's play. And some people are going to be like, who the hell are you? Hit the bricks, dude. How do you deal with rejection?
I've definitely heard that. I don't take any offense to it. And well, okay, I take that back. At the beginning of when I started branching out and stuff like that, I did struggle a little bit with that. But pretty quickly, I just took it as well, this is the universe's sign. This is not for you. And we're protecting you from something. So move on. And then when I started looking at it like that, okay, well, this person kind of rejected my ideas and me as a whole. And there's 7 billion people in the world. Not all 7 billion of them are rejecting me. So it's not as bad as we want to make it out to be. It's just the universe saying you are not meant to do this. Move on to the next thing.
This episode is brought to you by Jane, a practice management software and EMR I use to keep things running smoothly behind the scenes. When I first started looking for a practice management tool, I wanted something that felt like a teammate, not just more tech to figure out. That's why I switched to Jane. One of the things I love most about Jane? Their support team. You get unlimited help from real humans, even on Saturdays, by phone, email, or chat, all at no extra cost. It's easy to learn about Jane in your own time, too. Jane's guide is packed with helpful tips and updates, and it's always growing. And maybe best of all, Jane has a wonderful community of practitioners, so even if you're running a solo practice, you don't have to feel like you're doing it alone. I appreciate how Jane's tech support responds to my email inquiries and just the right amount of detail they provide in helping me to solve a problem. If you're curious about what Jane can do for your practice, head to jane.app/demo. And if you're ready to get started, use the code CHEOLOGICAL for a 1-month grace period on your new Jane account. I love it. You don't take it personally. So, nope, sorry, this one's not for you. These are not the droids you're looking for.
Exactly. Yes.
That's a fantastic attitude. And yeah, I suspect for some of us, that really has to be cultivated with a lot of intention because we're a little thin-skinned. Chinese would say you have thick face skin, right? It's just not for me. So thank you, universe. Next.
I think Ariana Grande wrote the song Thank You Next.
Oh.
And I think of that sometimes. I'm like, thank you next. We just need to move on to the next thing.
Yeah, that's incredible. I had no idea that the landscape looked that way. Doing the podcast as I do, I get to talk to lots of different people, and I hear from not a small amount of folks that there are struggles and there's a lot of conversation in our profession that it's in a rocky spot. Schools are failing, people don't have jobs, or it's hard to find a way to make a living. And so I hear that a lot. I'm hearing something very different from you that gives me some real optimism. Tell me more about, first of all, you got a job, too, so good for you. Tell me more about how you see the future of acupuncture as being bright, because you're at the beginning of your path here. Tell me what you see.
So I see, when I step back and I look at the field of acupuncture and Chinese medicine, like you just mentioned, I do see some struggles, and I see there are some schools that are failing. It's kind of like it's in a tough spot, but I do see that there is a large group of acupuncturists, Chinese medical providers, who do not want to see that and who are really, really fighting to not see that. I would like to say I see the future of acupuncture just becoming part of standardized medical care in America. There's a lot of states who have adopted the acupuncture physician title. A lot of states have adopted acupuncturists as primary care providers. And if you look at China, that is just the way of life over there. It's also the way of life in most European countries. And I kind of see it moving into that direction, not willingly. I think I see it getting pushed into that direction, which is good, which is what we need, because I don't see anybody else other than acupuncturists helping this cause. I mean, sure, there's a sprinkle of doctors and other Western medical providers who are helping the best they can or whatnot. But I think I see the younger generation of acupuncturists coming out and they're fired up. They're excited. They're fired up. I'm one of them. When they want to see things change, and they'll do whatever it takes. They'll join whatever committee it takes. They'll join the state associations. They'll join the federal associations. They'll speak up. They'll network. They'll do whatever they can in their power to push the field into the place where it should be. And I think it's not going to be too long before we see most all states adopting acupuncture as a method of primary care medicine.
And so when you say primary care, what would that look like for the everyday acupuncturist? I don't think we're going to be ordering labs and things of that nature, are we? Or will we?
Well, I mean, some states will let you order labs. I mean, if you look at the scope in New Mexico, it is shocking how broad it is. I mean, they can order IV fluids if they need to. They can do all kinds of stuff. They can do labs, they can do imaging, they can order phytochemicals, bioidentical hormones, they can do birth control, they can do life-saving drugs, things such as like EpiPens and inhalers and stuff like that. I don't think that should maybe be a thing that's pushed. But, I was just talking to someone actually yesterday afternoon, who is a really big advocate for acupuncture. He's also an acupuncturist in Massachusetts. And we were talking about the scope of practice because we're trying to get injection therapy into the scope in Massachusetts. And he brought up a good point. I think a lot of acupuncturists, this is just him talking, have forgotten that we have diagnostic and prescriptive authority and that we practice internal medicine. And this is something that sets us aside from chiropractors or physical therapists or occupational therapists. We have diagnostic authority as long as we diagnose according to the precepts of Chinese medicine. That makes us eligible to be primary care. And I think what I would like to see as like a primary care acupuncturist, it's very close to how Florida has it. And I have some really dear acupuncture physician friends in Florida who I just adore. And I've talked to them about this before. Basically, it's like going to your doctor. Like, you have a cold, you go to your doctor, they tell you to drink water and have some tea, and if it's really bad, here's a Z-Pack, and be well, salt and light, be well. You go to your acupuncturist physician and they give you a treatment. Let's say it's a when cold situation. They release the exterior, release the exterior treatment. You start feeling a little bit better. And if it's a true when cold, they'll give you a Guajertong formula or whatnot. Within 3 to 4 days, you feel better. There you go. Acupuncture physician just took care of your cold and saved you from having to go to a MD and get into the clinic and all of that. And acupuncturists are trained to obviously recognize red flags. If someone walks in with an exasperated asthma situation, I'm probably not going to do anything for them. At the most, I'll be throwing in a Jingwell point while I'm sending them in the ambulance to the nearest ER. So I think that's where, I see primary care medicine merging with acupuncture. Also, the fact, too, that America is so short on primary care providers. There's a massive shortage of primary care providers, PAs, nurse practitioners, MDs, DOs. A lot of the medical schools now have primary care pathways to where you can go for a discounted rate of tuition as long as you basically sign a contract saying that you'll practice primary care medicine for X amount of years. Maine does that. If you practice primary care in Maine, they will pay your student loans back as long as you stay in the state and practice. So I think that people are trying to fill some of that gap with acupuncturists who are more than qualified to provide primary care health.
Will, this is interesting hearing you talk about this. And it rhymes a little bit with when you were saying to your new boss, I'm your new acupuncturist. And she said, I've been looking for an acupuncturist. So it sounds like there is an issue with our healthcare system. Everybody knows it. We all like to say it's broken. It's got troubles. And the way that you've just laid this out here, it seems like a not unreasonable path to be able to fill a void that needs to be filled, right? I mean, yeah, people want to go the Western route. They can get their loans paid back if they're in Maine and all that. It sounds like there are incentives, but maybe there's a way to bring in other kinds of practitioners. I mean, look, how often do people actually see a doctor these days versus a nurse practitioner? So there's that. Now, what about other allied professions? Chiropractors are the first that come to mind. Why would they not be a good candidate for filling in that primary care space? Or would they be?
I don't think chiropractors necessarily would. I mean, if you look at my boss is a chiropractor, so I need to be careful. I love him to death, though. He's amazing. I'm so glad that I met him. But I think chiropractors, if you look at the scope of practice for a chiropractor, and if you look at the profession of chiropractic, they have diagnostic authority over musculoskeletal conditions. They can diagnose subluxations in the spine. Some states broaden it to a wider range of musculoskeletal disorders. They can diagnose based off x-ray findings, but that is it. It does not go into an internal medicine organ situation. And when I say internal medicine organ, like I'm thinking like Zong Fu and how we link the Zong Fu, our Chinese medical diagnosis, to a Western medical diagnosis. So if someone came in with, let's say, they had a pre-existing condition of migraines and they come to see us, on our diagnosis, we can put migraines due to liver yang rising. And then our assessment and our treatment, our physical findings, the pulse and tongue, all of that. And that sets us apart from other professions. They can't do that. And if we look at the ICD-11, there's acupuncture codes coming out. There's there's traditional Chinese medicine diagnoses coming out that we would be able to use. Is insurance going to pay for them? Most likely not. Are we hoping that they do eventually? Yes. But it just helps kind of standardize our practice as a clinically based internal medicine themed practice, if that makes any sense.
What I hear you saying, or what I think I hear you saying, is there are opportunities in our medical system. There are ways that chiropractors work, gives them, I'm going to say, authority over a certain domain. Ways acupuncturists work gives us an authority over a certain domain. Kind of overlaps with primary care, if I'm understanding you correctly. Will, it sounds to me like in addition to all the schooling you've been doing, and correct me if I'm wrong, you've also been looking at the broader landscape of medicine in this country with a focus on acupuncture.
Yes. So I've actually been working in healthcare since I was 15, so a decade. I started working as a volunteer EMT in my little town in Maine at age 15. And then I moved on to work as a pharmacy technician. And then after I got my undergrad degree, I worked as a technologist in a laboratory for a hospital doing chemical testing, microbiological testing, hematology stuff, all kinds of stuff. So I've seen the emergency side of things, I've seen the pharmaceutical side of things, and I've seen the hospital side of things. The hospital side of things the longest. I did medical tech stuff all throughout acupuncture school to survive. And, I've made a lot of relationships with doctors, nurse practitioners, nurses, DOs, all kinds of people. And when I look back on that, I kind of do have a very broad view of just health in general and medicine and everything that it encompasses. And I try to narrow that into, okay, well, we have this massive landscape, this huge landscape. Where's the path for acupuncture? And where is it taking me on this landscape? And do I need to change the path? Not personally, do I need to change it? Do I need to recruit other people to help me change it?
Mm-hmm. Yeah. So how is that happening right now? It sounds like you're involved. First of all, you have a vision.
Mm-hmm.
You've had a foot in both worlds, conventional medicine, and I don't know, do we call it complementary, alternative? What do we even call it these days? I don't know. What is the official term for what we do?
I actually don't know. I have heard complementary, alternative, holistic. I'm not a fan of the word holistic. I don't know why. It doesn't feel good when I say it. And I've heard of like natural medicine. I think the big one that's going around is complementary and alternative, just because there's a lot of board, like some states have an alternative and complementary medicine board. There's alternative and complementary medicine databases, things like that. So I think that's the word. I wish it was just medicine. I don't know who back in like Hippocrates' time was allowed to coin the word medicine, but it's medicine. Yes, it's Eastern medicine, but at the very root of it, it is just medicine.
I'm in violent agreement with you on that one. Sometimes I have patients come in and they've got something going on and they really want to use something alternative, or they really want acupuncture to work. They're convinced it will work. And I have to give them the news that, look, for what you've got going on, the right medicine for you is this thing over here. Go get an MRI, because we've just done 4 acupuncture treatments for this weird tingling in your hands, and it hasn't budged an inch. So there's a great thing called an MRI that will let us, at the very least, be able to rule out some kind of a problem or rule it in which case the best medicine for you is going to be something else, because it's medicine. I totally agree with you. We have different perspectives on it, but medicine is medicine. However, as humans, we all have turf. So we have to name it a certain way. We have scopes of practice. We've got, look, acupuncturists and physical therapists or whoever, right? The whole dry needling thing is, to me, it looks like a turf war. Who gets to use acupuncture? What are your thoughts on this?
Okay, so my thoughts on...
Don't worry, you're not going to get canceled off geological.
Okay, well, my thoughts on the whole dry needling situation, I kind of kept quiet when I first started hearing about it. 1, because I didn't know enough. 2, I didn't know what the PTs were doing. And 3, I just kind of wanted to like just watch. I got my little bag of popcorn. I sat back and I was like, I just want to see how this is going to play out. And I want to see how these more experienced acupuncturists handle this. And I'm going to learn something from them. And I'm probably going to learn something from the physical therapist. Let's be honest. So I waited a while before really forming an opinion on it. And it really wasn't until this year that I formed an opinion on it. And I've talked to multiple providers, PTs included, about this. And we also, at my school, we do a interprofessional event to where we do a low back pain case, and 3rd-year acupuncture students will do the demonstration and talk about the case under supervision of a couple faculty members that are there. And we do it with the physical therapy school, which is always really interesting to see how it plays out. But my opinion on the whole dry needling thing is, if a physical therapist wants to dry needle, let them. Just let them do it. If they think that the upper crust of the trapezius muscle, our gallbladder 21, has a knot and they want to needle it, have at it. However, the educational requirements for that need to really be upped. This whole idea of I can take a 30-hour dry needling seminar on TIMU, that doesn't fly. That should not be allowed. It needs to be like 300 hours, which some programs are starting to get to that. And some physical therapy schools are starting to adopt a longer dry needling class for people who want to be certified to do it. I was at the ASA conference this year, and I forget her first name, but her name is Dr. Sina. She's a general surgeon and also an acupuncturist. And she brought up a good point. This is where I got the whole idea from. If a PT wants to dry needle, let them. She's like, if someone comes to me and they're like, I have hypertension. She's like, I can treat that. She's like, that's easy. I'll give them an ACE inhibitor. If I want to do an acupuncture treatment for them, I'll do that. She's like, and I can send them on their way. She's like, I'm a general surgeon and primary care doc. I can do that. That's basic. She's like, that's easy. Anyone could do that. Anyone in healthcare should be able to do that practices Western medicine. She said, if someone comes to my clinic and they have a 3rd-degree heart block, I'm not doing anything for them. I'm sending them straight to the cardiologist, who is the expert on the heart. And she brought up a good point. She said, acupuncturists need to be the experts on needling. She said, these other professions, they're going to find a way to needle. They always will. And just let them. But they're going to run into a situation to where they absolutely have no clue what's going on. And they're going to need to send that person to an expert. And that person's going to be the acupuncturist. And she said all of this to say we can save ourselves a lot of time and heartache fighting each other if we just kind of adopted this mindset. And sure, we up the training for physical therapists who want to do dry needling, but we don't need to snatch it away from them. We don't need to do this, that's my toy, give it back. Let them play with it. Let them do it. And we'll keep our expertise in other realms that they will in time recognize.
I appreciate your perspective. And first, I just want to comment that as you started to see the issue, you weren't sure how to draw an opinion. I'll just sit and watch. Sit, watch, observe, take in some information. Man, you sound like you come from a whole different century. I mean, seriously, my friend, this is an attitude and a perspective that you don't hear so much. In our very instant world of opinion and belonging and identity, it's so easy to go, well, snap judgment, this is this and that is that, and because you're like that, then, I have to behave toward you a particular way. And to be able to come from a place of, I'm not sure. And I'm not sure because I don't actually have enough information. Like, you need some information to have an opinion. I don't know enough to have an opinion. I'll just observe, watch, gather data points, and then come to something. So I first want to point that out. I think that's a brilliant way to go about things. Being a person who entirely too often will make a snap judgment. I could use a bit more of that myself. So thank you for that. The other piece that you talk about, that we're the experts with acupuncture. We are the experts with knowing something of what these needles can do. I've been thinking about this myself lately. And in some ways I feel like, okay, does acupuncture belong to me, or do I belong to acupuncture? So if acupuncture belongs to me, then I should try to snatch those needles away from any other healthcare provider, because it's mine, damn it, and keep your paws off my knee. But if I belong to acupuncture, then I want to see it in as many places as possible to help as many people as possible. So why wouldn't I teach the nurse practitioner, here are a few points that can help people with their indigestion. Here are some points that can help with menstrual pain. Let them get started with alleviating some suffering so they don't have to prescribe a drug, so people don't have to go on synthetic hormones for gynecological problems. Like, why wouldn't I want more people practicing in that way? And then we have people like you and many of our listeners who we went through a lot of education so that we could know more and rest securely in that. Of course, one of the arguments would be, well, there are jobs that are being taken away from us. But right now, what I'm hearing from you and your cohort, at least in the part of the world where you live, there's plenty to go around.
I 100% agree with that. I mean, we don't see doctors fighting over drugs. We don't see a doctor saying, well, I can prescribe this drug and only I should be allowed to prescribe this drug. No one else should. They want it to be available to every doctor to prescribe. And I don't think we should be doing that with acupuncture. And I don't buy the whole job security thing. I just don't see that. There's too many people in the world that need acupuncture, and you could train every doctor in America to provide medical acupuncture, and acupuncturists are still going to have a wait list. That's just how it is. And also beside the fact that the acupuncturists who practice herbal medicine, they're going to still be really busy. So I totally agree. I don't think we should be saying, well, this belongs to me. This is my medicine. Actually, it's Wang Di's. Actually, it goes way back beyond Wang Di and goes all the way to like the beginning of time itself. It doesn't really belong to anyone. We're just people who know how to play with it and practice it and help people. But it's definitely not our birthright medicine, for lack of better words. It's nothing that we can just lay claim to and say, well, I developed this. This is mine. It's something that we share with other providers and our patients.
Yeah, it is something that we share for sure. And it's come down through time and culture. And so one of the things that is so amazing to me is that acupuncture has spread to all over the world, right? I mean, it started in Asia, fair enough, but it's everywhere right now. And it's been in the West long enough, both here in the States and in Europe, that it's got its own flavor, right? There is such a thing as American styles of acupuncture. And, it's such an incredible set of principles that, you can take it and just bring it alive in your own lifetime.
Yeah, for sure. I think that I would like to see Americanized acupuncture maybe become a little bit more, go back to its traditional roots a little bit more. And I think that we're starting to see that. I think that there's a lot of I think there's a lot of acupuncturists who do a lot of these like Americanized protocols that are laced into biomedicine. It's okay, well, your patient has polydipsia. This is the treatment that you give them. Don't do that. Stick to the precepts of Chinese medicine. What's their Chinese medical diagnosis? What does the pulse say? What does the tongue say? That's all you really need, and it's good. Your treatment's going to probably be more effective instead of just doing a broad spectrum treatment. I'm not saying that those don't work, because they do, but I just personally don't think it's the best.
As the year 2025 comes to a close, Golden Flower Chinese Herbs wishes you, your family, and your patients a warm holiday season full of joy and restful recharging. They have high hopes for 2026 being better. Remember that this season calls for slowing down as our chi retreats to the interior. We will be wise to respect that natural cycle. Golden Flower is here for you in this holiday season with gratitude from everybody at Golden Flower Chinese Herbs. Well, I really see it as an ecosystem. And as in any ecosystem, the thing that is successful and reproduces and continues is the thing that is successful, is the thing that works, is the thing that has some kind of an advantage. And if all we're doing is a protocol, these needles for this Western disease name, okay, sometimes you'll hit it and sometimes you'll be helpful. But if you're missing the underlying pathodynamic, and as you said earlier today, the other side of the story, right? There's all kinds of resources people often have. They're just not being utilized. And one of the wonderful things I found about acupuncture, East Asian medicine in general, it gives you access to incredible healing potentials that people already have in them. It's not a protocol. It's a way of viewing and seeing how the body is and how it needs some help. I think you probably get better results that way.
I would absolutely agree. I think that it's really hard to take a protocol, especially when we're practicing individualized medicine. That's what we're doing. We're practicing this individualized, natural, we look 100% at the individual. Someone who walks into clinic with, let's say, a severe, back to the migraine example, severe migraine, red eyes, like it looks like liver yang rising. It could be liver yang rising for one person. It could very well be heart fire for the next. It's very different. And the outcome for that treatment, the deciding factor could be, did you use liver points or did you use heart points or did you just do, 4 gates? Or like if you're using a protocol and you have the room for a diagnosis to be very different, you run the risk of the protocol actually not doing really anything and the patient not getting better, and then the patient's not satisfied with your care of them. And it's the same thing with herbs. It's the exact same thing with herbs. And it is a huge pet peeve of mine. And I need to be careful because, yes, I'm a student. I don't have a ton of experience, but I do have experience in healthcare and the practice of it. And when you see, okay, well, we took the pulse on this patient and their pulse says this, the tongue says this, and blah, 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 10 minutes, here's your formula. And you just kind of give that formula to everyone who has that tongue and that pulse. Well, that's not Chinese medicine. You're leaving out your whole questioning and examination process and just broad spectruming these formulas to people, I think is doing more harm than good. And it's just telling these patients, okay, well, when you have, this going on, you take this formula. Whereas then they actually might do better if you gave them something else, or if they took a different type of formula, or if they actually didn't have a formula at all. Maybe they don't even need it and they can save $30. Go home and sleep and drink some ginger tea. You can buy it at Dollar Tree. That will cure you. Sometimes it's just as simple as that.
Well, I think what you're talking about here, Will, is the capacity for discernment and to see what it is that people need. Again, this whole idea of treating disease names. People always come in with a disease name. They're going to tell us the disease that they have. They're going to often tell us the diagnosis, the Western diagnosis that they have. It's up to us to see, how does that fit from the East Asian medicine world? I don't throw it away, but I like to keep it off to the side.
I feel the same way. When I started out in student clinic, I cared a lot more about the diseases just because Chinese medicine was still new to me and I was still playing with the diagnoses and stuff. But pretty quickly, I felt the same way. I didn't really care about the Western medical diagnosis. I cared enough to put it in the back of my mind and just let it sit there, and then eventually it just gets recycled into the trash. But people would come in and say, "Oh, I have schizophrenia," and I'm like, "Great, moving on." I care enough for it to go in the back of my head. That's as much as I care for about it. Now I'm going to go into the Chinese medical side, and I need to find out what your pattern is. And that is the most important thing right now, is identifying the correct pattern and the correct treatment for you.
We're in complete agreement on this. I think many of our colleagues would as well. Here's a challenge, and maybe you can help me with this. Because the way that we practice Chinese medicine is like this. We're not looking at the disease name. We are looking at what's unfolding in this person. What's their ecosystem like? And the cycles that they're going through. But the Western, or I should say the conventional medicine world, doesn't work that way. It works on disease names. It works on the tacit agreement of, I've got problem X, you're going to give me a treatment to take it away. And that's a fundamental, philosophically different place to stand. So I hear your enthusiasm and positivity about the future of the medicines coming together, but this seems like kind of a sticky wicket. How do you get conventional medicine to play with Chinese medicine when we're not looking to treat a disease?
I think a really big help with that is the addition of the ICD-11 traditional medicine codes. I think those are going to be very helpful. Well, I mean, I know we're seeing a lot of acupuncturists now work in hospitals. There's staff acupuncturists at Boston Medical Center, Brigham and Women's, Cleveland Clinic, Mayo Clinic. A friend of mine just on social media just got offered a job out of the blue to be in staff acupuncturist at the Mayo Clinic. So I'm seeing these acupuncturists infiltrate and be like double agent into the hospital systems.
Double agents.
And I think that's what we have to do. I think that we kind of have to be double agents and go in, and we got to play their game. We have to play their game, and we got to speak their lingo. They're going to come at us with these Western medical terms. We have enough training in acupuncture school to play back, but then we can lace it with, that's actually chi stagnation. And let me tell you why it's chi stagnation. And for the next 2 minutes, let me tell you what chi is. And then there you go. You just educated a doctor. And these doctors are going to go around, the good ones, and they're going to tell other doctors this, and they're going to tell nurses this, and they're going to tell patients this, and they're always going to keep it in the back of their mind. Oh, this acupuncturist who thinks that needles can heal people told me all about this a couple weeks ago or whatever. And I watched them do the treatment and it worked. And they actually did help this person. And they're going to carry that with them to their grave, and they're going to educate their colleagues on what we do and just kind of disseminate it.
Okay. You're making a point here for us being fluently bilingual in Chinese medicine and Western medicine, and like the double agent idea. But really, it's just a matter of, I don't know. I remember at different times, I'd be in a class with someone who was really different from me, or I'd meet someone and just, they're really different kinds of people. I don't even know how to have a conversation with them because they come from a different culture, they've got a different religious background, or, whatever. But you're together in a class, you're together in a work situation. And over time, you just kind of get to know each other because you're doing things together, and you begin to see something of how they think and how they work and learn to appreciate it. And they begin to see something in you that maybe they didn't know. Oh, they get some benefit as well. And so what I think I hear you saying, Will, is that by being in these more conventional settings, speaking the lingo, Ellie Cole, we had her on the podcast, 6-8 months ago. She's got a whole program that she uses for helping acupuncturists speak the lingo of Western medicine practitioners. Because when you do, those practitioners are going to be very much like your new boss. They're like, oh my gosh, all I've heard was a bunch of gobbledygook. This makes sense to you. Can I send you patients? So becoming fluent in that, and then in time, they kind of pick up stuff from us. They get the idea, differential diagnosis, and they learn as well. So yeah, my friend, I can see your enthusiasm for the future in that way. That it's a lot of work, but what good work isn't a lot of work?
It's definitely a lot of work, but I'm fired up and I'm ready for it. Ready for it.
So wonderful. Well, any other advice or useful words or perspectives that you'd like to share, especially with people kind of like you, but didn't go to school with you, but they're at the beginning of their career or they're new enough in it that they're wondering, oh my God, what do I do next? What I thought would work hasn't worked. What can I do to keep moving my acupuncture career forward?
Sure, I knew you were going to ask this question, so I thought about it all last night. I would say to people who were like me at a very young age and are thinking about going to acupuncture school, if that's what you want to do it, you can do it. Go for it. You're not going to regret it. You're going to love it. It's going to love you back. You're going to continue. You'll just learn and learn. And if you're that kind of person that just needs to constantly have fire hydrant level information thrown at you, go to acupuncture school. You will 100% get it. You'll never be short. And there are a bunch of people out there, me, the recent graduates of Chinese medical schools, who are more than willing and so excited to talk to people who want to come into the profession because we want to see it grow and we want to see it become big. We want to see acupuncture school become the next medical school to where people are like throwing a party because they got accepted to acupuncture school, just like some kid who got accepted to Harvard Med. That's what we want to see, and we're here to support. My other thing that I would like to say to acupuncture students who are just starting out their program, the biggest piece of advice, and it's one who I got from a beloved teacher of mine, Dr. Bing Yang. She is the daughter-in-law of Dr. Huimin Ni, who was the supervisor to Dan Binsky. She was my herbal professor, and she's the director of herbal medicine at our school. Her piece of advice, it sounds simple, but when you really practice it, it's really not. Keep it simple. Keep it simple. Things don't need to be extravagant. Formulas don't need to have 14 different herbs in them. Acupuncture point prescriptions work with maybe 2 to 6 points. Keep it simple. And you are going to help so many patients that way. You're going to save yourself a lot of stress, a lot of worry, a lot of anxiety, and a lot of your chi too. I don't know about you, Michael, but when I do a herbal formula and has 14 herbs in it, I have to take a nap afterwards. I'm like tired, and so her biggest piece of advice to me was keep it simple. And that served me very well in acupuncture school. And I would give that same advice to anyone else out there. Keep it simple. Keep it simple. You have your whole life to let it get complicated. But right now in school, just keep it simple.
I think that keeping it simple is really great advice, and I would back that up as well. The other reason to keep it simple is when you're keeping it simple, you're clear with what you're doing. You're not trying to do 6 different things. You're not throwing in a little of this and a little of that because, well, I want to, like air quotes here, cover my bases. When you're working simply, you have to be clear with what you're doing. That takes some courage. Here's what I see. I'm going to just treat what I see. I'm going to do it as simply as possible. The reason for doing that is if it works, you know how and why it worked.
Exactly.
Okay? And if it doesn't work, you know how and why it didn't work. Now the system begins to teach you.
And that is experience.
It's really, really helpful. Yeah. Okay. One last question, and then I'll let you go. If somebody were to ask you about Jingwell points, what would you have to say?
If someone were to ask me about Jingwell points, I would tell them that they are perhaps my favorite set of points in Chinese medicine. I've been studying them since I was 15, probably only understanding them since I was 22. And they are the points at the end of the channel where qi emanates and where it is dynamic and where it warps. They are the most dynamic points. They are the crossover points of qi. And they flow along the channel and they flow down the Ying Spring, the Shu Stream, the Jing River, and the Hussey points, getting deeper and deeper into the channel and more consolidated the further down the channel it goes. And I love the Jingwell points, and my favorite Jingwell point is 100% lung 11 and spleen 1.
Lung 11?
The Jingwell.
Yeah, okay,
Jingwell,
right. So tell me more. Why are these your favorite?
The spleen 1 point, I just feel like it's just a really good point when there's a lot of excess in the lower burner, maybe crossing up into the middle. I just feel like it really does a good job clearing. I mean, it clears the entire channel if that's what the Jingwell points do. and it has such a calming effect on the shin. It's just, when you think about the spleen organ, you think of the muscles, the sinews, you think of blood, you think of qi. The spleen is very rich in qi and blood. You also think too that you're sending that qi from the Jingwell point up through the spleen channel. It's crossing spleen 6. And spleen 6 is it's the Sanyan Jiao. It's the meeting of spleen, liver, and kidney. You're affecting spleen, liver, and kidney, at least in my theories or whatnot. And just from like personal use on myself and the tiny bit of experience that I have in student clinic, very effective. And then lung 11, I just feel is also kind of, especially when paired with spleen, we think of like the tie-in. And I think it's just a really good reset for the entirety of the tie-in. It clears the channel, it activates the channel, it alleviates pain. And you're kind of opening, if you do them together, I've done before, you're kind of opening the upper burner and you're opening the lower burner and kind of the middle, but more so, and this is just from my inexperience, Michael, I'm by no means, shouldn't have any authority to say any of this, but from what it looks like to me, you're kind of opening the middle, the upper burner and the lower burner so that the middle can turn. And when we think of the Shaoyang, so you're opening the tie-in so that the Shaoyang can turn. And there's a whole, I mean, that's like another 4-hour discussion.
Yes, it is a longer discussion. Don't minimize the authority that you have. Okay. You've been through school, but in addition to school, you've been through a study of your own for almost 10 years now. I often hear newer practitioners say things like, well, I'm just a baby practitioner. I think that's not helpful. I think standing in the authority that you have, yes, you're at the beginning. That's awesome. But you've gotten through school. And not only do people get through school, but there's all the life experience that we bring. Even if you're young, you still have life experience. There's things you've learned. So go ahead and stand in your own authority. And I suspect you do that pretty well already because you're the guy who goes in and says, hey, I'm your new acupuncturist.
Yeah.
So,
well, that is very helpful to hear, Michael, because I won't lie. That is something that I have heard from other practitioners saying to students, you don't have enough experience. You should probably take a back seat. But to hear you say the opposite, actually, no, take the upfront seat. Take that front seat.
Yeah.
That's very, very encouraging to hear, very empowering to hear. So I thank you for that.
Drive it like you stole it.
That's right. Drive it like a Jingwell point's going to drive a channel.
All right. Well, congratulations on graduating. Good luck with your exams. I'm sure you'll smack them down. It'll be great. And in your new career, delighted to have you in the profession and looking forward to seeing what you and your cohort do as time goes on. This is a phenomenal medicine. I'm with you, my friend. I think there's plenty of opportunities. I think there's a lot of trouble, but look, the best opportunities come out of trouble.
Absolutely.
So I think you're positioned well.
Well, thank you so much, Michael Max, for having me on. It has truly been an honor, dream come true. I would have never thought in the entirety of my life I would be speaking on Qiological, yet here I am, and I really appreciate it. And I want to thank you and express to you how much I appreciate your podcast. And you definitely were a very large influence on me and coming into acupuncture as a young 15-year-old. So I am very grateful.
My pleasure. Stay in touch.
Yes, sir. You too. Thank you.
It was really fun to catch up with Will again after all these years. What started as a curiosity in high school led to a path that took him into the world of health sciences, and now all the way around to where he began with his interest in Chinese medicine. Except now he's got his learner's permit and all the paperwork needed to start his career as an acupuncturist. You never know when a friendly answer to an email might change the course of somebody's life. I'm delighted that the podcast was a source of information, inspiration, and maybe a bit of motivation for Will to set off in the direction of his interests. I'm encouraged that he sees a bright future for himself and for the profession, that he's already found work, as have a number of his classmates. So often we hear the stories of gloom and doom, the people not practicing after a few years, the challenge of building a practice or working out the dance steps of integrating into the world of conventional medicine. But after this conversation, I feel more optimistic. Will and his cohort are the newest practitioners on the block, and at least for them, they see a bright future. which is good because the future of our profession, it's in their hands. You've made it all the way through this episode. I suspect there's something in this conversation that held your attention, maybe gave you some unexpected insight or reminded you of something that you know well and appreciate. Why not seize the moment now and share this podcast with a friend? They'll be glad to know that you're thinking about them. Geological is a team effort. Ruth Asparis and Ann Manalo are our editors. Neil Matthews is the WordPress dude who tames the tech. Lauren Delfonzio keeps us all organized. And Sharon Sherman, who brings her eye for detail and reliably asks the troublesomely helpful questions. If you love the podcast and would like to contribute financially to help keep the microphones hot and the servers juiced up, become a member. There's some benefits too. Details are on the website.